Hey guys, welcome to the Wijay Andry Show, where we talk about all things plastic surgery. It's a husband and wife plastic surgery group. Today, we're going to be talking about what high BMI, tummy tucks are, rectus diastasis, who's a good candidate, and how to be safe and get a really successful result. Hey guys, Dr. Wijay here. We are back at the Wijay Andry Show. Today, we're going to talk again about part 2 of tummy tucks. We're going to dive a little bit deeper into different BMIs and how low, medium, and high BMIs change your results, change your complication profile, and what you need to expect. Our co-host, Dr. Andry, is in the operating room today, so this is the best part about the show. Some days will be me, some days will be Dr. Andry, and soon we'll be starting to have guests that we're super excited to bring onto the show as well. So let's just jump into it. I have a few photos here on my phone from Instagram at Dr.Wijay that you can look at, and then they'll be flashed on the screen to help. But I'll describe it too for those who are just listening. So let's just go from high to low. So everyone, just a quick summary of tummy tuck, which we talked about in episode 2. Tummy tuck is best for a person who has that excess skin. So if you have excess skin, especially if it's rolling over a C-section scar or rolling over and hanging on your pubis, you are the candidate for a tummy tuck. If you got rashes underneath that flap, having a tummy tuck is probably the best option for you. Liposuction, unfortunately, will help remove fat, but it will not take away that excess skin. And if anything, liposuction will make that excess skin worse. So going back over what a tummy tuck is, it's a low bikini line incision that will hide in a 2-piece bathing suit, standard underwear. Once we cut out that excess skin, tummy tucks includes excision of that excess skin. We go on to repair diastasis recti, which we talked about in episode 2. We then make our signature belly buttons to be super cute and super natural so no one knows you have a tummy tuck, followed by liposuction of the sides. So when we talk about tummy tuck, we're talking about liposuction of the flanks, muscle repair, diastasis recti, cute belly button, and a low incision and excision of that skin flap. So that's a tummy tuck. So why do people get concerned about high BMI tummy tucks? And the reason is the same reason that anyone gets concerned about high BMI. High BMI is that you have more fat. And when you do any surgery, not just tummy tuck procedures, if you do any surgery or have any infection, the higher the BMI, the more risk factors you're going to entail. There's been so many plastic surgery studies that have correlated high BMI with, more infection, more wound healing problems, more fluid retention. And so that's why people have concerns when we do high BMI tummy tucks. So when you have high BMI, that means in theory, it doesn't mean always. Now, BMI is such a, can be a debatable topic because there could be someone who's super tall and muscular and have a high BMI, but they're totally fit. But in theory, when we're talking about high BMI, we're talking about a woman who may be a little bit larger and has a little bit more adiposity on her skin, on her belly side or on her flank side. So when you have that, you have a chance that this person may have diabetes, may have pre-diabetes. And when you have diabetes or pre-diabetes, you're going to have wound healing problems, tummy tuck or any surgery. That excess sugars in your blood does not help with healing. When you can't help with healing, then you're more prone to infections. You're more prone for those incisions not to heal. And if those incisions don't heal, that's not just external incisions. We do things called progressive tensions that help bring that tummy tuck skin down and tight. You're going to have more fluid retention because that's not healing. The other thing is, if you have to imagine, if you're higher BMI, in addition to potentially, not saying you have diabetes or hypertension, but you may have things that are close to it or not quite there yet. So you're dealing with those other comorbidities. You're dealing with a bigger incision, right? So if you're a smaller girl with a smaller BMI and a smaller tummy tuck, your length of your incision is smaller. So you have less, that person has less to heal. If you're a higher BMI, of course, we're going to take out a lot more tissue. We're going to have huge flaps that we're going to remove because that's what's hanging over your pubis. And you're going to ask your body to heal a bigger wound. So that's just a harder thing for you to do. You just have to heal a bigger wound. So therefore, of course, you're going to have something potentially happen where you have an incision or wounds or other things. So what do we do, and what precautions can we take for these higher BMI patients? First thing is we do a full blood workup. We make sure your protein levels are okay. We make sure your hemoglobin is okay. Make sure your sugars are okay. So just because you have high BMI doesn't mean you have diabetes. Doesn't mean you have any of these comorbidities. But we want to make sure we have all the tools in your body to heal. Protein is so important because that's the building blocks for everything that we're going to use to heal this incision. And then the other thing you need to understand is that just because you have more of a risk of a little bit of wound infection or a little bit of a fluid collection from a high BMI doesn't mean that you don't deserve to have a tummy tuck. Because, the way I look at it is if you're a high BMI and you have a lot of skin hanging over your pubis, then you deserve to have relief, right? Because that skin that's hanging over your pubis is inhibiting you from wearing your clothes properly. It's inhibiting you from exercising and getting to that next weight class. And so you are plateauing or you're stuck because this pannus or this overhanging skin is on your pubis. And it's not fair because, genetics or past injuries or anything that you've gained some weight or pregnancies or whatever it may be, hormones, that you're not able to have this surgery to help relieve some of those symptoms. So I believe that patients with high BMIs, if they're optimized from a nutrition standpoint, from a blood standpoint, should get a tummy tuck. So we make sure you're safe from a nutrition standpoint. And then the next thing is just counseling. Because what we need to explain to this patient is like, this is an aesthetic procedure, but it's also a reconstructive procedure. We're taking out the skin so that you can feel better, look better, fit better into clothes, but it's not exactly going to be super, super tight like potentially I can do someone with a low BMI, because I don't want to pull you so tight that you're not going to be able to heal. So we're going to take extra caution to make sure we pull you appropriately so you have a significant difference, but nothing that you wouldn't be able to heal. And then we see our patients every week, and through seeing that patient every week, if there's any wounds or anything, we can take care of it through basic local wound care. And 100% of our patients, if they have a little stitch or whatever, we go on to have those wounds completely heal. Most people don't have any problems at all because we take our precautions, and those who do, we just follow them up until they're perfect 3 months out and everything is fine. Whether you're low BMI or high BMI, every patient has the risk of a DVT. And so DVT ultimately is the major risk that we worry about. So we put people on blood thinners after surgery to prevent that. And as long as we don't have a DVT, then any little wound is going to be considered pretty small and manageable comparatively to a DVT. So then people will say, I need to lose 100 pounds before I have my tummy tuck. And I'm like, if you're going to lose 100 pounds, you should definitely lose that weight first. But if you've been trying for the last 5 years to lose 20 and you haven't, then you're not going to likely lose 20 pounds in the next month. So what I've seen instead, and I'm going to pull this picture up. I think this is an amazing picture. This is a patient who I did a tummy tuck and 360 lipo. And I'm going to have this picture on the screen. For those listening, on the picture on the left, she definitely has a skin overhang. She's got fullness to her back of the lower back level love handles, upper back roll, and fullness of her belly. So I go on to do a medium/high BMI tummy tuck, very standard, very sexy. She looks great after surgery, minimal wound problems, everything goes well long term. But now she's flat. So after this patient lost that skin that was hanging over, she had the motivation to fit well in clothes and then go on to lose weight. So you can lose weight after surgery, just 1 pound a week to be safe. Now, if you're going to lose 50 to 100 pounds, do that before surgery. But if you're going to lose 10 to 15, then you can decide if you want to have the surgery and just lose your weight after, or lose your weight before. I can go either way, and this is a proof that you can lose weight after surgery. It's just an amazing result. Okay, so the next one that is on the screen here is a patient with the higher BMI, of course, has a hernia around the umbilicus. But when you see this patient, you're like, this patient, she can't exercise very well with this. She can't fit well into clothes. She's got a hernia here as well. So and that's why I'm a believer that people, who have higher BMIs can come to me or any surgeon who feels comfortable with it, because a patient like this deserves to have that skin off of her abdomen so that she can be more comfortable in clothes, be more active after she heals. So that's why I'm a believer in high BMI tummy tucks and, the risk benefit and explaining to patients how to make sure to get this healed. But you can see on the after, she's flat. She fits better into clothes. Obviously, we're not going to show other photos, but this patient showed me multiple pictures of being on trips and being so happy. So these are the motivations that, doing larger BMI tummy tucks, if it's the right candidate, right person who's healthy and who can handle surgery, can really change this person's life. Okay, let's see what we got here. So now this is a patient here that lost a lot of weight. So she was high BMI, then went on to have a gastric sleeve. So we do a lot of patients after gastric sleeve, Roux-en-Y, any type of weight loss surgery. Now they end up losing 70 plus to almost 150 pounds. And now they have tons of excess skin, double rolls on that skin. So this patient was high BMI, but we still have to take all those high BMI into consideration, because even though she's not high BMI now, she had weight loss surgery. So when you have weight loss surgery, your gut, and depending on what kind of surgery technique they use, changed your absorption of vitamins, proteins, nutrition. So we have to take other cautions to make sure patients like this can heal these type of wounds. And so these people are the most amazing candidates for tummy tucks. So you can see when you have this double roll, you make a low tummy tuck incision. She's wearing a faja in this photo. Belly button is super, super natural. And you release that flap so that she's smooth, fits better in clothes, feels sexy, and then goes on to lose weight slowly in that faja. Okay, so this third patient is a perfect candidate. The perfect candidate to show you something super interesting, and that is the diastasis recti. This patient has skin overhang. She definitely does. It's not as much as someone who would have massive weight loss or super high BMI. But if you look at her belly, it is very poochy. It pooches out a lot centrally. And the reason for that pooching out a lot centrally is because from her pregnancies, when her uterus expanded with the child, it stretched the muscles, the rectus muscles, your ab muscles apart. And then when the babies were delivered and the uterus shrank, the muscles didn't quite come back together. So internally, your intestines are pushing on that space between the muscles, causing this pooch. So she's medium BMI, BMI 35 plus, but she's got this pooch that's going on. And this is just incredible to show you. Once you get inside and see that muscle separation, you can repair those muscles and you can see how flat her tummy becomes. Now, she's becoming flat in addition to the surgery of the tummy tuck alone, but pulling skin doesn't just make you this flat. This is a muscle repair. So this goes on to show you that there are different types of body shapes that all can benefit from tummy tuck, but these girls are the ones who benefit the most from muscle repair. The one prior is the one that benefits the most from a tummy tuck because of the weight loss and so on from that high BMI. This fourth patient, another high BMI patient. She's only about 3 weeks out, so she's still a little full on the bottom aspect, but you can definitely see from the straight on view and the lateral angled views that she's got a very large a skin adiposity centrally that is definitely overhanging. That's definitely hard for her to wear clothes, to exercise. And once this is gone, if you look on the before photos, you can't see the underwear. And then you look in the after photos, you can see that the incision is low. You can see the full underwear. And now she's flat. Yeah, she's still swollen. She's only 3 weeks out, but in 3 months when all the swelling is gone, she's wearing her faja, she's going to be super flat. And it's not just because of the tummy tuck she's going to be super flat. She's going to be super flat because we fixed her muscles, we tightened her skin, and then the motivation all patients have after surgery when they have this procedure. This is another patient, higher BMI too, and this just goes to show you that when you have that double roll, you do that tummy tuck, low incision, remove that excess skin at the bottom portion, and that double roll. We also repair the muscles. This is a patient that in some people's hands would be considered a higher BMI, and it's not necessarily that she looks like a higher BMI from the photos, but her actual weight, she's just bigger boned in the sense that her weight is higher. So therefore her BMI is higher. And so that's why, it is important to have BMI cutoffs and all this stuff, but that's why evaluating the patient independently and figuring out what's best for the patient is the best scenario for picking and choosing. But this is just a super cute swimsuit result, low incision, cute belly button. Just loving this result here. This patient is a massive weight loss patient. So this goes on to show you again that Roux-en-Y surgery where they cut the bowel out, or a gastric sleeve where they shrink your stomach. They have a lot of excess skin that's just draping over the underwear. So the moment you take that out, their skin is smooth, they fit into clothes better. All that skin overhang, it just causes so much rashes and chafing. And now she doesn't have to worry about, powder or creams or antibiotic ointment. Like, these surgeries are so powerful for patients who've lost weight. Oh, I love this patient. This patient, this is another fantastic example of muscle repair. Again, multiple children, patients, super fit, super in shape, but she's got that central bulge. And so you're looking at her and you're like, man, her hips look good, her legs look good. She looks like a small person, but she's got a big central bulge. Why? The answer is the muscles have separated. The muscles separated from her childbirth, and they just never came back together. So once we repair the muscles, get her super tight, then we pull the skin down. So it's a combination of skin pulling and muscle repair that can give her to this super tight, flat, amazing result. Just super happy for her. And that's the last photo I wanted to show today. But going back to everything, is high BMI is safe to do if the patient is optimized from a nutritional standpoint, optimized from a blood work standpoint, optimized from no diabetes, blood sugars, and definitely no smoking. We don't let people smoke 4 weeks before or 4 weeks after. Then after that, it's just managing, what is your result going to be after a high BMI tummy tuck. The purpose of that surgery is to remove that skin that's overhanging, make you feel better in clothes, and then go on to lose weight in a safe, healthy manner. And then, as you can see for some of these photos as well, is diastasis recti, and showing people that what separation in the muscles can look like on a patient, and then what the after would look like on a patient once those muscles are repaired, once that skin is tightened down. So here at the Oaks Plastic Surgery, we definitely do high BMIs. We definitely like to keep patients over for observation after those surgeries for fluid management, pain control, and extremely important walking protocol. The day of surgery, we need to walk around to prevent any DVTs. The next day, we start our Lovenox shots to prevent that. So if you have any further detailed questions about tummy tucks and high BMI tummy tucks and who's a good candidate, leave it in the comments. We'll answer those questions, and we're going to move on to some other topics next week. But we will bring tummy tucks, of course, is one of the main procedures we do here. So we'll definitely touch back on it in the next couple weeks coming up. So thank you guys for joining us at the Wijay Andry Show, and hope to see you guys soon.